our system will not prevent disasters to happen, but our system will improve patient safety in general. That I'm sure of. And then I hope less disasters will happen. Looking in a structured way towards a practice does really help quality improvement. And it surely helps the practice cooperation within the team, and it surely helps when there are basic underlying problems in the cooperation between the practice members. It does reveal them. So it helps in getting better levels of care.
The main advantage is what happens in your practice. The practice team is performing better, is growing, is getting more mature, and is working from another perspective. Service, patient safety comes into perspective more than formerly. Even when people were very well-meaning and they wanted to deliver good health care, they are improving by taking part in the system. That's one advantage. Second advantage is that you have a better impression of what patients really find important and how they give feedback to your practice. And that's really, you start to feel more free to ask patients their personal opinion about the way you're performing, and that's something which gives a reward to your system.
Any disadvantages?
Time. It's time consuming, especially in the beginning, and you feel always a bit threatened by who is going to make use of this system. A system which was put up from a quality improvement perspective doesn't necessarily always mean that somebody else could not take advantage of it. So you feel vulnerable because you do not know exactly who is going to make use of the data. And you must be very secure, very strict in handling that.
Data-based quality, and there we have problems. We run immediately into problems because on what type of indicators can you really measure quality? And as a GP, as GPs in general tend, in my opinion, to be a bit too, not too progressive. They always state, our consultation is not measurable, dot. We are so special, our patients are so special, we are not measurable. And I tend to disagree with that statement, because a lot of things are measurable and some are not. And that's something which I'm interested in your views about. But we must be sure what we measure and why we measure it, and what will be done with the results. We must have trust in what they do with it.
In terms of quality, I think it's more or less the same, although there are more patient safety instruments introduced, like checklists, etc., which gives an improvement. In overall terms, I would say that the quality of care is more or less comparable to 10 years ago. But it comes at a cost. If you leave the budget system, it means that you get rid of the waiting lists, but it means extra costs for the healthcare system. So we see a considerable rise in healthcare costs since 2006.